Hello, I'm going to first talk about the normal functioning heart. The heart itself is made up of 4 chambers. It has 2 atria and also 2 ventricles. The conduction system is made up of several different components. First is the synatrial node. Establishes the basic rhythm of the heart, and it is also considered the pacemaker of the heart. Second, it consists of the atrioventricular node, the atrioventricular branches, the bundle branches, and also the conduction myofibers. These components coordinate the contraction and the relaxation of the heart. The condition that I'm going to talk about today is congestive heart failure. This is a long-term condition when your heart can't pump blood well enough to get your body a normal supply of blood. In a result, the blood and fluids collects in your body, in your legs, in your arms, in your other organs in your body. The term congestive refers to the resulting of the backing up of fluid in your ankles, your legs, your arms, and also in other organs in your body. So what I've done is drawn a picture of a bus stop. So you have the bus stop, which is considered the congestive heart failure. Right here's your bus stop. One bus pulls up, another bus, and another bus. So this is starting to cause congestion. You have other traffic coming up behind, meaning nobody can go through. Everything is congesting, having a buildup. So kind of like congestive heart failure, where you'd have no way to get the fluid to go through the body. So when blood can't flow through the left side of the heart, it flows back up into the body, into the left atrium, and into the pulmonary veins, and then also into the lungs. So when you have a person that presents to the doctor's office, they will show symptoms of breathlessness, having shortness of breath. They will have a cough, usually has like a sputum that they will cough up that has like a pink tinge to it. They have orthopnea, which is shortness of breath. This becomes worse when they lay down. They'll have proximal nocturnal dyspnea. So this is when they lay flat at nighttime, they get woke up, they're coughing really heavily. Most of the time when they sit up, sometimes they stand up, the fluid will go back down into the bottom bases of their lungs. And then sometimes they'll have to, get to a fan or get to a window to catch their breath. But standing up most of the time will help them, because when they're laying flat, it causes them to have less lung area to breathe. So when they stand up, the fluid goes to the bottom of their lungs. Also peripheral edema, which is edema in their lower part of their legs, their ankles, their feet, their toes. Sometimes their toes get even have swelling there. So how to diagnose having congestive heart failure? They'll have a clinical assessment, so you can see shortness of breath, the swelling, have a blood work done so they'll check a BNP, have an echocardiogram done, and also an ECG. So different causes of congestive heart failure could be ischemic heart disease, valvular heart disease, hypertension, and also arrhythmias. Different medications that people can take for management of congestive heart failure would be like an acronym of ABAL. The A being ACE inhibitors, B would be beta blockers, C, aldosterone antagonists, and then the L would be loop diuretics. So the ACE inhibitors and beta blockers are the two that they would start a patient on whenever they get diagnosed with congestive heart failure. If those two medications aren't working, then they will next go to the aldosterone antagonists. They will use the loop diuretics whenever a patient is having symptoms most of the time. They can add it on to the other medications that they are taking. A patient that is taking one of these 4 medications, or just a medication in general to treat congestive heart failure, needs to be monitored for electrolyte disturbances, just because the fluid will be being pulled off of the body to help with congestive heart failure. So you'll have to monitor the patient for electrolyte imbalance. Thank you.